Hello everyone, this is I will teach you medicine. Today we are learning about asphyxiants in forensic medication and toxicology. So without any further ado, let's get started. So what are asphyxiants? Okay, so they are non-toxic or minimally toxic gas. Okay, so what do they do is they reduce or displace the normal oxygen concentration in the breathing air. So that what will happen is O2, like oxygen depleted in air, can lead to death by asphyxiation. Okay, so there is a like asphyxiants gas are not toxic. Okay, so they are like non-toxic gas, but what they do is that they reduce the quality of oxygen that we are like taking, right? So what happens is the amount of oxygen that is should be required, that gets deteriorated, right? Now let's talk about toxic gas. Okay, so toxic gas means it is caused by it causes death by other mechanism. Okay, so that is either by competing with oxygen on the cellular level, like carbon monoxide, or directly damaging the respiratory system. So that is a phosgene gas. Okay, so asphyxiants are non-toxic, but toxic gases are toxic. Okay, so what happens is oxygen gas will reduce the quality. Okay, reduce the quality of the like air we are breathing in. So what happens is the oxygen that is like in very less amount. Okay, so depleted amount. So it will cause death by asphyxiation. Okay, but toxic gas, so what happens it will like cause it will damage. Okay, it will damage the cellular level mechanism, or either it will like destroy the respiratory system. So example it are carbon monoxide and then phosgene gas. Okay, so here are some examples. Okay, so hydrogen cyanide, carbon monoxide, hydrogen sulfide, sulfur dioxide, chlorine. Okay, hydrogen cyanide, HCCM. Okay, hydrogen cyanide, carbon monoxide, and then hydrogen sulfide, and then chlorine. Okay, hydrogen sulfide, chlorine, and then sulfur dioxide, and then tear gases. Okay, tear gases, that is known as 2-chlorobenzyl malonitrile. Okay, 2-chlorobenzyl malonitrile, 2-chlorobenzyl malonitrile. Okay, so that's important thing. Okay, so cyanide, what happens in cyanide is it make mechanism of action. Okay, so cyanide is very important, right? So it interferes with the cellular uptake of oxygen by inactivating cytochrome oxidase. Okay, cytochrome oxidase, as you have already studied in like paper, respiratory system, right? So cytochrome oxidase, that is very important. Okay, so it will interfere in the cellular uptake of oxygen by inactivating cytochrome oxidase. Okay, so this is like in the generation of that mitochondrial respiration, right? So inactivating cytochrome oxidase, okay, thereby resulting in the tissue anoxia, that is also known as histotoxic. Okay, so what happens when there is an acute exposure in cyanide? Okay, cyanide, it will have weakness, confusion. Okay, headache and nausea, weakness, confusion, headache, nausea, and then the main thing is metabolic acidosis. It will cause metabolic acidosis, and then gasping or the difficulty in breathing, and then loss of consciousness, right? So loss of consciousness can also occur, and then seizure prior to death. Okay, so prior to death. Okay, so headache, confusion, weakness, confusion, headache, nausea, metabolic acidosis, and then gasping for air, and then loss of consciousness, and then seizures, and then respiratory or cardiac arrest. Okay, so respiratory or cardiac arrest, that is also very important. So the CNS and the myocardium are especially sensitive to the cyanide exposure due to their high demand for oxygen. So like only the myocardium and the central nervous system, okay, brain, they will be like very much affected by this cyanide poisoning, right? So because they need very much high demand for oxygen, so if cyanide will inhibit the cytochrome oxidase, and then it will inhibit the respiration, right? So this will cause very much it will cause like effects on the other organs too, but mainly on the CNS and the like brain and the myocardium, right? So order of the bitter almond, okay, it is like it smells like a bitter almond. I don't know if you have like know you are familiar with the smell of this, but bitter almond, right? So cyanide is bitter almond. So what do we do? So the treatment for cyanide is you antidote. Okay, use of antidote with washrooms, they are highly toxic to themselves, so they include nitrites or sodium thiosulfate. Okay, nitrites र अनि त्यसपछि चाहिँ नि sodium thiosulfate, and assisted ventilation, that is 100% oxygen and cardiac monitoring. Okay, treatment includes assisted ventilation, that is 100% oxygen, very much high flow oxygen, and then cardiac monitoring, and then supportive measures. Okay, so nitrite and sodium thiosulfate, cyanide antidote, nitrite and sodium thiosulfate, nitrite and sodium thiosulfate. So nitrites. So nitrites is one soft capsule of 0.2 ml amyl nitrate. Okay, nitrite is crushed and inhaled for 30 seconds per minute under until IV sodium nitrate is begun. Okay, so nitrite and then sodium thiosulfate, right? So nitrite, it is one soft capsule of 0.2 ml. Okay, 2 ml, and then one soft capsule of 0.2 ml amyl nitrate, nitrites. Okay, so it is crushed and then inhaled for 30 seconds per minute. Okay, 30 seconds or minute, I think, not per minute. Okay, sorry for that. Inhaled for 30 seconds or minute until IV sodium thionite is begun. Okay, so what we do is first amyl, so we have to treat it by amyl nitrite. Okay, amyl nitrate we have to take 0.2 ml. Okay, and then we have to inhale it. Okay, for 30 seconds or minutes. Okay, and then we have to IV sodium nitrite should be given. Okay, so how it is sodium nitrate given? It should be given by 10 ml of 3% solution. Okay, solution that is injected slowly. And then what is nitrate? After nitrate we have sodium thiosulfate. Okay, so sodium thiosulfate, so in sodium thiosulfate, we have 50 ml of 25 percentage of sodium thiosulfate. Okay, that is IV after the administration of nitrite, and then repeat half dose if symptoms persist. So antidote for cyanide are nitrate and sodium thiosulfate. And in the nitrate, 0.2 ml of amyl nitrate is crushed and then inhaled, for 30 seconds or minute until IV sodium nitrate. Okay, so IV sodium nitrate is begun to injected, IV. And then in sodium thiosulfate, after that nitrate, then sodium thiosulfate. So sodium thiosulfate is 50 ml of 25 percentage of sodium thiosulfate IV administration. Okay, so this is what sodium thiosulfate, cyanide positioning is to be done treatment. Okay, so note, nitrates causes cyanide to be removed from the heme group of cytochrome oxidase, allowing sodium thiosulfate to desoxify the poison by catabolizing the cyanide to the non-toxic thiocyanide. Okay, so what does it mean? So nitrate, so it will remove, the cyanide is attached, in cyanide poisoning. How does it cause asphyxia? Okay, so it will cause it will go, the cyanide will go, and then it will get attached. Okay, it will go and attach to the heme group. Okay, heme group of cytochrome oxidase. Okay, so cyanide goes and attaches itself to the heme group. Okay, of heme group. So this is like cytochrome oxidase, so it has a heme group. Okay, so it will go and attach to here. Okay, cyanide will go and attach to here. So what will nitrate do? Nitrate, it will go and then from the, it will remove. Okay, it will remove the cyanide from here. Okay, heme group, and then allowing the so it will nitrate will remove the cyanide from the heme group of the cytokine oxidase. Okay, so that's its job. Okay, only cyanide will remove it. And now what we do is we do sodium thiosulfate. Okay, so sodium thiosulfate will now act on the removed cyanide. Okay, it will detoxify the poison. So how does it do? It will detoxify the poison by catabolizing cyanide, the non-toxic thiocyanide. Okay, so it will cyanide. Okay, cyanide is here because it was removed by the nitrate group, from the heme group of the cytokine oxidase. And then now sodium thiosulfate, it will detoxify the cyanide into the non-toxic thiocyanide. Okay, so that's the mechanism of action. So it's very easy if you want to try to understand it yourself as well. So that's it. Okay, so cyanide poisoning, there are two antidote. Okay, nitrate and sodium thiosulfate. Other are supportive measures, right? So high flow oxygen and cardiac monitoring, because my cardiac needs more oxygen concentration and all, oxygen demand. Okay, and then supportive measures, any kind of other type of demand. So what we do is nitrate and sodium thionide. So nitrate is 0.2 ml of amyl nitrate is crushed and then inhaled, for 30 seconds per minute until then what do we do? First amyl nitrate is done. Now sodium nitrate is placed in IV, that is 10 ml of 3 percentage, okay, solution. And then in sodium thiosulfate, what we do is 50 ml of 25 percentage of solution of sodium thiosulfate IV after administration of nitrates, okay. And then after administration of nitrates, so nitrate should be administered, and then only 50%, 50 ml of 25 percentage should be administered, okay. Now mechanism of action. So cyanide is usually attached to itself in the heme group of the cytochrome oxidase, okay, cytochrome oxidase. So cyanide will remove, no, nitrate, okay, nitrate will remove the cyanide from the heme group of the cytochrome oxidase, okay. Now nitrate's job is done. Now what will come? Sodium thiosulfate, okay. Sodium thiosulfate will it will change the cyanide from toxic to non-toxic form, okay. So that is known as non-toxic thiocyanide, okay. So that's it. So now the fatal dose and fatal period, okay. So inhalation of the cyanide gas in concentration of 0.1 ml per liter, okay. So 0.1 ml per liter, you know, that will cause death in an hour, okay. So high concentration along with minutes, okay. So it's very like toxic drug, okay. So it's a very toxic asphyxiant, okay. So orally fatal dose for liquid cyanide, okay. So liquid cyanide is 50 ml, okay, but in the like gas is 0.1 ml per liter, okay. And then cyanide salts, okay, cyanide salts is 0 like 200 to 300 milligram. That is very much fatal dose, okay. So forms of cyanide, CYAS cyanide forms, they are gas, and then liquid, and then salts, okay. So gas, that is 0.1 ml per liter, okay. And then liquid, it is 50 milligram, and then salts, it is 200 to 300 milligram, okay, 200 to 300 milligram. And then the fatal period, okay, fatal period is 1 to 2 hours, okay. Fatal period is 1 to 2 hours, within 1 to 2 hours, okay. Now so anyone with cyanide poisoning, if they die and then they come to the like mortuary, you know, for the autopsy, so what do? It like we find the order of bitter almonds, okay. So it is very distinguished, and then we will see cyanosis of the extremities, okay. So because it has like displaced oxygen and all. And then pink red color of the body, okay, pink red color of the body particularly evident in the area of the hypostasis, okay. So it will be evident in the area of hypostasis. And then increased venous hemoglobin oxygen saturation, okay, increased venous hemoglobin oxygen saturation. So pink or red color of the body, okay, pink or red color of the body particularly evident in the area of the hypostasis, okay. So this is very important. Hypostasis is like pinky, you know, pinky red color, okay. And then congestion of the GI tract, okay, if the poison has been ingested. And then cerebral and pulmonary edema, okay. So bitter almond test, and then cyanosis of the extremities, and then pink red color in the hypostasis. This is MCQ question, all right. So pink red or cherry red, it's in the cyanide poisoning and all, okay. And then GI congestion, you know. And then again we have to do edema of the pulmonary and the brain, okay, cerebral edema. So what is the medical legal importance, right? So the medical legal importance of cyanide poisoning, okay, it is associated like mostly like with accidental or suicidal, okay. And then homicide with cyanide is rare because like it's very hard, okay. So cyanide gas has been employed as a method of execution of criminal who has been sentenced to death, particularly in some states of the United States of America. So USA has like it uses them to cyanide to kill the any kind of criminals that are subjected to like death, okay, capital sentence, okay. And then members of mainly terrorist organism carried with them cyanide capsule, okay, when they are consumed when apprehended by law enforcement officers to invade in the integration and the punishment, okay. So it that is very important, very much important, okay. So suicidal and homicidal, and then the not homicidal, sorry, accidental is common, but homicidal is rare. And then in USA cyanide is used for execution. And then terrorist, what do these terrorists do? They will, whenever they get caught while performing any kind of terrorist activities, like bomb, they are planning to bomb the whole city. So what do is so, and if they get caught, by somebody, by law enforcement, so of course they are terrorists, right? So they are going to be interrogated, okay? So but they are very much strict about their, like they are very loyal to their organization somehow, so terrorist people. So they will like they will self-destruct themselves, right? So in like technical words, self-destruction occurs, and they take the cyanide pills, cyanide capsules, and then they will die like very much soon after even getting caught. So they will like evade the interrogation and punishment, just like it is said there. Okay, now let's go to the main part. Okay, carbon monoxide, this is very much important. So carbon monoxide has 250 times more affinity to hemoglobin than oxygen, okay, and combines with it rapidly, depriving the tissues of the like what happens is, like if an oxygen is attracted to hemoglobin by one, okay, so by 1 unit of any kind, okay. Let's give an example, okay. So this is but carbon monoxide is attracted to hemoglobin to 250 times more than oxygen, okay. So what happens is, if carbon monoxide is like somewhere in your environment, in your room, if it is produced by there by somehow any kind of like means, like electric heater, and then from the coal and all, so the affinity of the carbon monoxide is 250 times more than that of oxygen to a heme molecule, right? So it will replace, it will throw away the oxygen, okay, because it is most certainly more attracted, okay, to hemoglobin. So it will deprive the tissues of the oxygen supply, and then what happens is, about 15% of the inhaled carbon monoxide can combine with the extravascular protein like myoglobin, okay. Only out of 100%, only 15% of carbon monoxide it will combine with myoglobin, okay. But hemoglobin, what happens is, it has 250 times more affinity than the oxygen, okay. So I hope this you will like take in your brain, okay. So that's the mechanism of action, okay. And then what is the usual fatal dose? The inhalation of a carbon monoxide at a concentration of greater than 0.1%, okay. From in the cyanide it was 0.1 ml, right? So in this carbon monoxide it is 0.1 percentage, or 1000 ppm in the atmosphere for few hours can be fatal, okay. But in the atmosphere, if it is 1000 ppm, so it is that. And then lethal blood carbon monoxide level of 60 to 80 percentage, lethal blood level is 60 to 80 percentage, okay. Carboxyhemoglobin, okay. Lethal blood carbon monoxide is 60 to, if it reaches the level of 60 to 80, then it is lethal. But also we have to be very much aware that it has high affinity, carbon monoxide has high affinity to hemoglobin. So attaining 60 to 80 percentage is not so big deal, right? The numbers may look so very much like big deal, but 60 to 80 percentage is not so big with any kind of like asphyxiant that has like 250 times more affinity to an hemoglobin molecule. So now signs and symptoms, okay. So it's very important, okay. So 60 to 80 percentage of like carboxyhemoglobin is required to be seen for symptoms, okay, signs and symptoms, okay. So what happens is 10 to 20%, okay. 10 to 20% is what happens is exertional dyspnea, okay. It will cause exertion in the dyspnea, is difficult to breathing, and then mild frontal headache as well, okay. And then 20 to 30% is what happens is, from exertional it will improve to like dyspnea, okay, increasing dyspnea, okay, and then again severe headache, okay. And then in 30 to 40 in 30 to 40 percentage of carboxyhemoglobin level, vertigo will cause, vertigo, and then blurred vision, confusion, and nausea, okay. CNS has been affected, like vertigo happens, blurred vision happens, and then confusion happens, nausea happens. So this was all like local, like respiratory and local, and all mild symptoms, okay. But in 30 to 40, vertigo, blurred vision, confusion, and nausea occurs. And in 40 to 50, carboxyhemoglobin level percentage, weakness happens, trismus happens, muscle spasm, and vomiting. Weakness, trismus, muscle spasm, and vomiting, okay. And then in 50 to 60, convulsions, respiratory failure, and coma, okay. First, vertigo, blurred vision, confusion, nausea, weakness, trismus in the muscles, and then spasms, and then vomiting, so toxic effect has been seen. And then convulsions, and then respiratory failure, and over 60 it is death. Okay, so these are the signs and symptoms. We have to give it by the carboxyhemoglobin level percentage. Okay, so diagnosis. So a simple test can be done by the attending doctor is to dilute the 1% of the patient blood with 10 ml of water in a test tube, and then 1 ml of 5% of sodium solution of NaOH is done. Okay, sodium bicarbonate. So it's like a chemical lab. Okay, so a doctor, they will take a test tube, right? So what happen is they will add 1 ml of patient's blood. Okay, and then they will add 10 ml of water. Okay, water, and then they are like mixed. Okay, so after mixing they will be like one same thing. Okay, so it is water of 10 ml, okay, plus blood of patient is 1 ml, right? And then what they will do is add one drop, 1 ml, not drop, and 1 ml of 5% of sodium bicarbonate. Okay, and then if now here some reactions will occur, right? So this is chemistry, right? So what happens is if the solution turns brown, so it's normal. Okay, normal. If it's brown, it's normal. If it's brown, it's normal. If it is like straw yellow and pink yellow. Okay, pink, not yellow. Okay, straw yellow, yellow and pink. Okay, yellow and pink are very much dangerous color. You are not expecting, like you are expecting, but you may not want the patient to have either pink or straw yellow. Okay, so straw yellow, it is like less than 20. If it is straw yellow in color, it is less than 20 percentage of carboxy hemoglobin. Okay, but in the pink it should be greater than 20 percentage of carboxy hemoglobin. So it is like carboxy hemoglobin ko like pink. Okay, so pink is the dangerous color. Okay, it may look pretty at first, but it's very dangerous, right? So brown means normal, straw yellow means less than 20 percentage of carboxy like carbon monoxide in hemoglobin, and then if pink it is more than 20 percentage. Okay, so this is like diagnosis, simple diagnosis. What should we do? 1 ml patient blood, 10 ml water, and then 5 percentage of solution of NaOH. Done. So treatment, what is the treatment? So immediate removal of the source from the exposure. Okay, so if they are like taking, if the patient, they are like in the cold weather, cold season, what most of the Nepali people do is take the koila, right, in their room, and then they will like suffocate themselves. Okay, so if these symptoms is seen, like by any person, by any medical personnel in the room, so what they have to do is the first thing they would do is removal of the source of the oxygen exposure, right? And then high flow oxygen, that is 100% oxygen should be given. Okay, and then it is like very much like oxygen is deprived more on the like heart and the brain, right? So we have to do is cardiac monitoring and then respiratory status also, and then ICP, intracranial pressure, is increased. Okay, if this intracranial pressure is increased, what do we do is corticosteroid is given, hyperventilation, and then mannitol, and then head elevation is done. So any kind of convulsions, okay, we have seen like convulsions can be seen in carbon monoxide poisoning, so it is given by IV diazepam or phenytoin. Okay, and other are all like supportive measures. Okay, so postmortem appearance, right? So in postmortem appearance, what happens is cyanosis happens. Okay, and then congestion happens. Okay, dilated pupils, petechial hemorrhage, and then cherry red color imparted to the body, particularly due to the areas of the hypostasis. Okay, cherry red color in the in the cyanide it was like bright red, right, bright pink, but in the carbon monoxide it is like hypostasis, cherry red color. Okay, so that's it. And then pulmonary and the cerebral edema, of course, and then causation of viscera with PTK on the lungs and heart, and sometimes in the white matter of the brain. Okay, so there will be PTK, blood vessels, small breakage, so that will be present on the heart and lungs, and sometime in the matter of the brain. And then in addition to the written viscera, okay, so preserve lungs in an airtight container for chemical analysis. So we can see carbon monoxide. Okay, so airtight container, carbon monoxide is preserved, and then it is sent for chemical analysis. So now next is collective specimen of blood in a test tube must be always covered with a layer of liquid paraffin. Okay, paraffin. Okay, so this is a normal like blood collector, so in test tube always first we put the blood, and then we have to place the liquid paraffin. fin, okay, so to avoid evaporation, that's it. So what is the medical legal importance and circumstances of poisoning? We should know that, right? So most commonly it is accidental. In winter, room and doors and windows are closed and fire flames on the heater to warm the room, right? And then another is working in a closed garage where an automobile engine is running, okay, so this is also very much like circumstances, okay, this can be also be seen. And then another is fire in a cold space, okay. So in western country it is not an uncommon practice for a suicide victim to gas himself by connecting to a tube from a exhaust pipe into the interior of the closed car, okay. So in western world countries, like what they do is they for performing suicide, you know what they do, they will uh, they will they will gas themselves, okay, by connecting a tube from the exhaust pipe from the interior of the closed car, okay. And that will cause to death, you know, cyanide poisoning, carbon monoxide poisoning. And homicide with carbon monoxide, but there has been reported from time to time, okay. So that's it. So I hope you got it, guys. So it was very much like small topic, okay. We mostly talked about cyanide, okay. We learned about the difference between asphyxiants and toxic gases, and then cyanide, it's cyanide, you know. And then how it causes like any kind of asphyxiation, you know, cellular uptake of oxygen by cytochrome oxidase, okay. And then histotoxic anosmia can be occur. And then acute exposure, all the signs and symptoms. And then treatment, you know, nitrate and sodium thiosulfate. And then other supportive measures, you know. And then how does like nitrates को पनि दुईटा हुन्छ नि, thiamine nitrate and sodium nitrate. And then how does sodium thiosulfate acts on the on the in the cyanide that has been replaced from the heme group of the cytochrome oxidase and all. And then fatal dose, you know, in three forms: 0.1 ml in gas, 50 milligram on the liquid. And then cyanide salts for 200 to 300 milligram, okay. And fatal period, that is 1 to 2 hours and all, okay. Post appearance is like bitter almond, cyanosis of the extremities, pink red color of the body due to increased venous hemoglobin oxygen saturation, and then all. So medical legal importance. And then carbon monoxide, you know, what is its mechanism of action, how does it like 250 times, okay. So we have emphasis more on the 250 times, okay. So that's all about carbon monoxide. And then signs and symptoms. And then diagnosis in a test tube, you know, any kind of person can do it, simple test. And then we have also like a treatment for the removal of carbon monoxide, you know. And then ICP, how it is managed by corticosteroid, hyperventilation, head elevation and all, you know. And then IV diazepam for convulsions and all. And then like a post-mortem appearance, you know, all the cherry red color. And then hypostasis, edema, and then congestion, and then dilatation, etc, 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 okay. So thank you guys. If you like this video, then please consider subscribing. See you in the next video. Bye.